December 2nd, 2024.
No, hello, hi, oh.
He's vicious.
Is she, is it he or she?
He.
Oh, hey.
Odie.
Looks like a twin brother to this other patient you have. She
Oh.
was one of those.
Yeah, Chihuahua Terrier.
Okay. First time here. How did you find us?
Internet.
Okay, you live around here?
He's somewhere around here.
Okay. And how long you been in Vegas?
A while.
Okay. And you are Bernice
Sills.
Okay. All right. So you are 52.
Mm-hmm.
Oh, happy birthday.
Thank you. Coming up. I think I'm going to go to Vegas for my birthday.
Don't go wild. You married, single?
Single.
Kids?
Separated. Yes, adults.
Okay.
Very proud of them.
All right. And you take prescribed medications?
Correct.
Okay. When was the last time you had a mammogram?
Not that long ago.
Okay, so your OB/GYN takes care of it?
I would say about 3 weeks ago.
Okay.
I need to get the results.
Okay, what about colonoscopy?
That was in August, I believe,
Okay.
of this year. I need to find I have a GI, I'm sorry. Let me ask my GI, my new one, to do a test on malabsorption. It's getting all the nutrients out. It's if I don't do vitamins, so it's
what goes down if you don't take vitamins?
Oh, just my energy, weakness, bone pain. Excuse me, I have learning disabilities. Malabsorption. Yeah, you can tell by the stools, oily, sleepy.
Yeah, that's a GI thing. I don't know.
Yeah. Oh, that's right.
When was the last time you had blood workup?
About a month.
Okay.
I can do some. I haven't eaten anything today. Except my vitamins.
We don't have the lab here, not yet, but we're working on it.
Oh, okay.
Our volume is very low, so it's kind of difficult. But it's just starting to pick up. So anything specific we need to do? Do I need to order anything for you?
Yes, please. Endocologist. And because of the pituitary mass, the adrenal glands that sit on top of the kidneys, they're growing at a rate. They need to be out. But I have some major surgeries coming up, so I'm trying to hold that one off until after.
What surgery?
A full hysterectomy, like robotic one.
And what's the reason?
Endometriosis, but they're looking for bladder cancer. I can't say the word endometriosis, whatever it's called.
Endometriosis?
Yeah, that's it.
They're usually very painful.
What?
Endometriosis.
Yeah, it's not painful. That's weird part.
Okay.
But the other doctor says it's something else. When I went out of state, they said it's bladder cancer, and they're saying it's fibroids and all this other stuff. So I'm getting two different.
Okay.
I don't care who's right, who's wrong. Just get it out. I can care less. I live here, so it's better to do it here with family and stuff.
Yeah.
So, they're doing a bladder cancer, starts with a C, to check for biopsy and stuff like that. Pictures, cameras. I forgot what it's called.
Oh, cystoscopy.
There you go.
Do you have blood in your urine?
Yes, it's been like that.
And you've been bleeding, like
Yes.
discharge bleeding?
Yes, not discharge. It's in the urine, only in the urine.
And when are they going to look with camera?
They're going to look for cancer.
When?
Oh, when? I believe this month, but I believe about a week or two. And
You
then,
smoke or you did before?
no, never smoked. Yeah. And I have learning disabilities, so I'm a little autistic. So if I don't look at you and not be rude, I just.
It's okay. What kind of work do you do?
Oh, I don't anymore. But I did healthcare for RNA, restorative nurse assistant.
Okay.
I work with different, I know all kinds of things. I was working under the physical therapy, but I also did CNA. I also worked with disabled adults.
Okay.
Yeah, I did a lot.
Alright.
But I can't. And my learning disability's gotten worse, it seems like.
Are you seeing a counselor?
For what?
You
Nope.
have a service dog?
Oh, no. He's my therapy dog. That's all I need.
Okay.
My counselor, my therapy is my wine and my friends. So that's all you need. Let me see. I need a hematologist doctor, and that's because of anemia. It's called. I'm pretty good. I'm a Heoka empath, so I kind of.
What kind of anemia?
It starts with the MAC.
Oh, macrocytic.
Yeah.
Did anybody check your B12 or folic acid?
Check my what?
B12, vitamin B12.
It's
because
good.
hematology, they push back a lot.
Yeah. Oh, you tell them that. Yeah, I have a history of my dad died of cancer.
So they're not going to, we can try, but they're not going to, from my experiences, they're not going to see you because you want to see them.
See, you guys are hiding. This is what I'm talking about. I've been trying to see a hematologist for almost a long time.
Okay.
I have anemia. I need to get it checked out. What kind of anemia? So I do need a hematologist.
Right. So what I'm saying is that I can order the test for you to find out what kind it is.
Yes, exactly.
So
Yes.
that's what I'm going to do.
Yeah. And an endocrinologist, which there I need, and an ENT for the nose, for the behind the eye.
So what's going on with your eyes and nose?
Well, my nose is just perfect, but behind the eye, I feel pressure. Sometimes it droops a little. Once in a while, that cyst is pushing against my eye, and we need it fixed as soon as. I need a surgery done.
You had the CAT scan done?
Yeah, that's
And
what
there
it
is a
says.
cyst
Yeah,
behind
there's
your sinus?
Yes, in the sinus, correct.
Okay.
And that's it. There's 3 ones because everything else is getting fixed. Everything I have thyroid is a problem, but I have a thyroid coming up with diagnostic.
What, you doing ultrasound?
Yeah, they're gonna do an ultrasound on that because that means. And I have vagus. I forgot to put that, but I have vagus nerve damage. I put my whole hand down my throat.
How did that happen?
I don't. That's weird. I think it happened in 2020, but I think it got worse when I fell down about a year ago. I hit my head, and but I never really got checked up on anything about my head. But the vagus nerve is damaged. Somehow between there and there, it's gotten worse because I used to have gag reflexes. Now I can just put my whole fist down my throat if I want to because no gag reflexes. And then, and then I fell out a window, so that could have made everything worse.
When?
That was my stupidity. At my son's house because I was cleaning up. And
How old were you at the time?
52. It just happened like October 13th of 2024. I'm getting an MRI done on my, because I told the doctor, hey, my gastric, whatever it's called, muscle is damaged, I can tell. And they go, okay, we're going to get you MRI. Because you can barely touch it, it hurts.
Yeah. How old were you when you fell out the window?
52. Lucky I didn't break my, lucky I have good bones still, but I'm telling you.
How tall was the window?
It was pretty high. It was like 5 or 6
Second?
feet. No, not second window, but the first. But I felt like my drop foot caught me.
Were you on a ladder?
No, what happened was I cleaned up the house and everything was wet, so I didn't want to ruin everything all perfect because it took me hours because he left the country. So Mama here, I didn't have a key, so I only had to lock the door. Well, as long as I went out the bedroom window, and that's when I held on. But if you would have saw the bruises, you would have been, oh my gosh. I did go to emergency room. Thank God there was no blood clots. Because it was so, I hate to say, but it was black. It wasn't like bruised. It was, it looked like black leg. And, yeah, compared to now to then, yeah, you wouldn't probably notice. But right here is still very, very tender. So they're gonna do a MRI on it just to make sure everything's good.
When was the CAT scan you did of your sinuses?
I would say just a few months ago. But somebody must
What
have
symptoms
put
did
their-
you have before they started ordering the CAT scan?
Oh gosh, droopy eye, pain, headache. Those were the three main ones. Not vision problems, blurry at times, but that could be the Cushing disease, and that's part of the cyst too. So you got a mix of everything.
Okay. So I will check your blood. I will check your vitamins.
Yeah, check the thyroid because
Yeah, we'll do the.
it can
You
come
take
and go.
medicine for thyroid?
Say it again?
You take medicine for it?
No,
Okay.
no. I first did the blood test and all.
Okay. Come, have a seat.
I hear. Sorry. It's okay.
How old is the dog?
13 years old.
No.
But he became my service dog months ago.
Deep breath. Okay, here you go. Okay. Lay down.
Oops, sorry. Now, out of state, they said something is tied up.
You're not cold?
Nope.
Outside?
No.
Okay. Something is what?
It hurts all right here.
It hurts?
Oh, yeah, because of the tumors.
Oh, okay. Alright. Sounds
I
good.
do a pedicure. Oh, okay.
You're funny. Have a seat. So, we'll do the blood work. I'll send you to ear, nose, and throat. We also need to get the imaging. We'll get your
And the
stuff from the.
hematologist. And the
And-
hematologist.
So,
Three
hematology, I would hold off until we get the blood test results.
So what?
I would hold off the hematology until we get the results for your blood workup.
Well, it doesn't matter because I have a history of anemia. So,
Do you get blood transfusion?
no. But I take iron pills every day. If I don't, you'll see a dip in my iron.
So let me add the iron to it. How long have you been on iron supplements?
For 2 months now.
And who started you on it?
I did over the counter.
So if your iron is low, then yes, you need iron, but if it's not low, you don't need it.
If I do not take the iron medication, my iron will drop profusely. And I will get weak and tired and be a whole different person. Like very, not myself. So yes, I do need iron medication. And I need a refill on I showed you that refill. I need the 2 refills.
I'll take a look. Let me see.
So hematologist, endocrinologist, and the ear and nose.
Okay. Referrals, I'm not sure how long it takes. You can wait or they can get in touch with you later. The labs, you can have the lady at the front to print it out.
So do I get a copy of the referrals?
Yeah.
Yeah.
Okay.
Alright, cool.
Give
We're
us
done.
a few minutes, we'll get you going. Yeah.
All right,
Nice
thank
meeting
you.
Take
Thank
care.
Always seeing a hematologist. What doctor does that? I'm anemic. I need to get fixed. And again, today is December 2nd, 2024.